right, shall we get started? It's time. Welcome, all four of you. I'm going to encourage you to sit closer to each other. You can stay back if you don't like to sit in the front row, but we will do a few interactive things, so you will need somebody to talk to or to listen to, if you will. So I appreciate that. My name is Linda Cochran, and I am the regional lead for CPIN. Anybody know what CPIN is? Yes, tell me. So what do we do? CPIN. Yes, we train on foundations and frameworks and various other CDE, EECD publications. So we have Region 5, which is this county, Santa Clara, Monterey, San Benito, and Santa Cruz. And included with the slides is how to get in touch with your regional lead. There are 11 regions in the state. I don't know where y'all are from. Let me see who's here, first of all. Early childhood folk, preschool, K-12 folk, special ed, parents, teachers. What did I miss? Tell me who you are.
I'm a recreation therapist in the city of Sunnyvale.
Okay, recreation therapist. And you are? You're preschool, okay. So this is aimed primarily at preschool, and hello to our virtual audience, wherever you're looking from. It's good to have you here. I know some of my friends are out there. Hi, Lorraine. This is an overview of a presentation that we do that's about 3 hours long and allows for interaction, but because we're such a small group, we may be able to do more than what I anticipated. So this is probably, as educators and therapists, one of the hardest things we have to do is talk to parents when we have a concern about a child. And we'll get more into what we mean by concern. But you're all nodding at me, so I'm assuming you're agreeing. I got an amen on that one. So we'll go through some do's and don'ts and advice. Were any of you here for Dr. Sparrow's presentation previously? I wanted to go back and change my slides real quick. But I'm glad you were there, because he had a lot to say about this as well. So it's a perfect lead-in to what we're going to talk about. And I didn't get all the 8 questions that he talked about written down, but I will surely follow up and put them in this presentation. So this is just a claimer or a disclaimer, giving credit where credit is due, actually. So this was developed by the California Map to Inclusive Childcare. And the website is California Inclusion, or CA Inclusion, if you will. And those are the people who house trainings on social emotional development, as well as a lot of resources for teachers of kids with special need. So this was developed, if you know Linda Brault, some of you may know Linda Brault, was developed in her shop. And CDE has approved it. And we just changed our name from EESD, Early Education Services Division, to EECD, which is Early Education and Care Division. So to be more reflective of the variety of settings that children find themselves in. Websites and laws, those are updated, what we have in here. These are online for you, but please do not modify them or use them. If you would like this training brought to you, just contact me or the regional lead in your area, and we'll bring it to you, okay? And you can duplicate it, and it does have credit. It's got the map on the slide, so you can feel free to share the copies of the slides, but don't present, okay? Thank you. Okay, so what we're gonna do, what we're hoping you walk out of here with after the last session of the last day of the conference is some tools to add to your toolkit when you need to speak with parents. So when you're getting ready to share those concerns, we're going to talk a lot about the preparation and what you need to do before you have these hard conversations sometimes. And then reflect together a little bit on how parents might react to this information. Have any of you been in this situation where you had to talk with parents about a concern? Yes, all of you. We'll probably have time to talk more specifically about what they are. So think back to one of those times when you needed to do that and reflect for just a minute about what it felt like. What were you feeling? Okay. Feeling words are sad, mad, glad, scared. Like those are my 4 basics for kids, but feeling, what were you feeling? Repeat for?
The virtual audience with the audience.
Oh, repeat it, okay. Turn to, for my virtual audience, wherever you are, turn to a buddy, elbow partner, and share your feelings that you had when you were getting ready to meet with a parent in what you thought might be a challenging or a difficult conversation. Okay, anybody want to share feelings? I'm relying on all 4 of you.
A little bit nervous.
Yeah.
And empathetic.
Okay, so you felt nervous and empathy for the parents, the family. Okay, good. Anybody else? Feelings.
Anxious.
Anxious, yeah, a little bit of anxiety. You're not sure how this is going to go. You're not sure how they're going to react, right? Other feelings? Anybody excited about it? Sometimes it can be that way, but usually those are common feelings for all of us when we have to have sometimes difficult conversations or share information that might not be readily received. So that's often what I hear from folks is anxious, nervous. Sometimes I hear scared. Sometimes I hear sad, because there are a lot of things that go into this process of talking about kids with special needs and or other behaviors. We're not just talking about that. So I call early educators early identifiers, right? Because as people who work with children birth to 5, and maybe even later sometimes, we see these things first. We may notice a difference first. Parents may or may not have noticed a difference in this child. So we're going to look at how we determine if this is something that we should be concerned about. But many times, and Dr. Sparrow was talking about this earlier, the parent is the expert on that child, right? We, as educators, have knowledge of child development in general, usually, or typical development, or physical development in the case of a recreational therapist. So we're looking at what we're expecting to see, and we're taking all that collective knowledge that we have gained over the years and applying that to this group of children. So we often see things or sense things sometimes about children that may or may not be evident to the parent and may be situational, and we'll talk about that as well. So when do you guys decide if you need to have a formal conference? I'm not talking hi at the end of the day or, you know, had a great day and all that stuff. But what is your criteria for that decision? Yeah.
For my age group, I work with toddlers.
Right.
So we give them, it depends on the circumstances. If they're first time in childcare, you know, what are their family experiences? Because sometimes it's just getting adjusted to being at the center. Whether it's language, you know, so we base it on
Go ahead.
how long they've been with us, because they do transition from class to class.
I'll paraphrase.
Toddlers to twos and so on.
Right.
So sometimes they may have attachment
Issues.
Or like, you know, they haven't been here very long with us. Just give them some time to adjust, and then we kind of go from there based on the child.
Okay. So I know we didn't give her the mic, so those of you who are listening virtually, she was saying that one of the very first things you said was, it depends. And I love that answer. I've taught the college level teacher preparation for a long time, and I always say to teachers, the answer in child development is always, it depends, right? Because it depends on the circumstances, it depends on the environment, it depends on the family of origin, it depends on so many different things. So what I'm hearing you say is that you're looking at all these factors before you even decide if this is really a concern or not, right? It could be just typical development, right? If they're toddlers and they're suffering from attachment issues, the first time they've ever been away from the parent, they may be crying a lot or acting out sometimes. So I think it's important, and what you did is what I call doing your homework. And we'll go into that a little bit deeper. Does anybody else have a thought about how they prepare for these types of conferences? No? Okay, you're all asleep already. Okay. So this is sometimes some of the reasons. When you notice a difference in a child in relation to typical development, taking into consideration individual variations, and looking at whether or not this behavior or this, whatever you're seeing, delay, is interfering with the child's ability to learn. So that's kind of a checklist for you to think about before you go there. And then, this is another part of your homework, you have observed the child in different times of the day, different settings, with different people, with different children. You have documented your observations, and you still have a particular concern. And how long do you think it takes to change a behavior? Especially one that's working. How long? Any guesses? 6 to 8 weeks or up to 3 months in a young child. So if tantruming has been successful for me, if I flip out at the grocery store and mom buys me a lollipop to help me be quiet, then that's a behavior that's working for me, right? So all is to say, we need to give the child, once we've designed an intervention, and we'll talk about how we do that, but once we've done that, we need to stick with it to fidelity. And everybody in the classroom has to be on the same page, right? So if we've done what we know how to do, what we have in our toolkit, and we still have concerns, and many of us who have worked with children for a long time, sort of, I tell teachers, follow your gut. There's something that's telling you that you need to do more. And listen to that inner voice, because it's often correct. Okay, so if you're not able to support and help this child, we'll talk about what some of the other things that you can do. But we want to sit down with the family and talk to them about what's going on. And why would we want to do that? Yes, just what Dr. Sparrow was saying. These parents have a wealth of knowledge. An example I often use is if you want to hold a new baby, right? They say, do you want to hold the baby? And you take the baby and you do whatever you do with babies, and the parent says, oh no, he likes to be up here like this. He likes to look around, right? How does the parent know that? Baby didn't say, hey mom, would you put me up here on your shoulder, turn me around so I can see what's going on in the room, or that makes my tummy feel better, or whatever. How does the parent know that? Exactly, by experience, by being in tune. Ron Lawley calls it being in tune with a child, doing the dance. When the baby does one thing, we do something else, right? In response to that. And that's what we know creates attachment. Okay. So why do we need to know about typical development? Kind of a silly question. Why do we need to know that? There we go.
That way we have a guideline as to what we should be observing in children's development.
Okay.
That way when we do see something that is not atypical or typical, then we know that the child needs some support.
Right. So beautifully said. I don't need to repeat that. We need to know what's typical, whatever that is. I have a niece who she went through the teen years where she didn't want to wear anything that mom wanted her to wear, and she wore all black. and everything, and her mom was trying to get her to wear a dress to go somewhere. And her mom is my sister. My sister said to her, "Why can't you just wear something normal?" And she looked at her and said, "Mom, normal is so overrated." I always think of her when I think of what's normal. But so there is variation within typical. We know that. We know that not all kids walk at 1 year, but many do. So we need to have something to compare it to. And sometimes it's not so obvious, and we need to have some resources to go back to. And that's exactly what I have for you next. Okay. So what do you use now as resources for typical development? Anything? Oh, I have something for you. The Preschool Learning Foundations and Curriculum Frameworks are 2 books that have been developed by the California Department of Ed relating to what children should know and be able to do. Those are the foundations. And in the preschool foundations, it's at 48 months and 60 months, so the end of the first and second year of preschool. There are also infant toddler foundations. And the framework is sort of like the how-to, a teacher's guide, if you will. It's full of rich information. And both documents are available online through the California Department of Ed. And I have on the slides, which have been posted on the website, the resources for that, where you can find those. And so this is what we're doing right now. This is kind of my job description right here. And professional development. And then you probably know DRDP, maybe? Yeah, Desired Results Developmental Profile. And that's an assessment system that aligns with the documents that the state has designed. And also all state preschool programs use them, and all Head Start programs use them in California. Not all programs do. And then we also have a general program guideline and resources. So those are all things that are available to you free online in case you want to check. And that's just what the book looks like. We cover 9 domains, which are social emotional, language and literacy, English language development, mathematics, visual and performing arts, I lost my laser, physical development, health and well-being, safety, social science, history, social science, and science. So all of those domains are covered within. Although we know with young children, we're not teaching one subject at a time, right? The learning is integrated with them. Okay, so I think I told you this already, but they're for all children. Jolene said earlier, if you were in the last session, when we say all, we mean ALL, underlined, capitalized, and sometimes they even put it in red. So we're really looking at children on all areas of whatever abilities or disabilities that they may present with, okay? And the caveats to a good quality program are those things like support. So when we talk about support, we mean not only teachers, we need families as well, right? And then the quality pieces, there's a lot that goes into quality, and I'll leave that for the books to look out. This just shows you how they're laid out, how the foundations are laid out. So this happens to be phonological awareness, and this column is blank because it's not necessarily a skill that we would expect children to master, although some will at that area, which is really not relevant to our topic today, but this is the one that's on the slide. And it just shows you that the domain is Lang and Lit, the strand is reading. I know that's hard to read from where you are. And the age is here. The substrand is phonological awareness. There's the foundation itself. And then you will have some examples. And I think this is one of the things that's really helpful for teachers is there's something, I'm seeing something here, but I'm not quite sure what it is. This is a place to go, take a look, and see. It's not meant to be a test or an evaluation. It's just to make you think about what this might look like in the classroom. We talk about children making learning visible, right? So you can almost tell what kids are thinking sometimes by what they're doing. Not always. So, and then there'll be often in that book footnotes that will address children with special needs. Okay. So we're not going to do that because we don't have enough time. But it's just important to know that the curriculum strategies are developmentally appropriate. They need to be thoughtful and planned. We call it sometimes intentional teaching. There are some things that kids will do, like walk, maybe, or feed themselves, maybe, without necessarily intentional teaching. But there are things, especially when it comes to academics, if you will, that we need to be intentional about. And then it's always accessible and inclusive of children with special needs. And you've probably heard in many of your workshops that a lot of the adaptations that we use for children with special needs benefit everybody. They all can benefit from those kinds of things. So I have these on your slides that you can download, and the links to where you can get the documents if you'd like to have them. And there's the infant toddler, and you can either buy the book or keep it on your computer. A lot of my teachers keep it on their computer because then they can flip, right to where they want to be. And they're also color coded. So now we're going to talk about feelings once again. So when you're concerned about a child, as someone who works with them that is not a member of their family, but rather a member of the community, you talked about anxious, nervous, but you might be worried about what's going to happen to the child in the future, just as the parents are, right? So we as teachers, especially beginning teachers, because I've worked with them for so long, think we can save the child from the family, right? And how many times have you heard teachers say things like, I love being with the kids, it's those parents that drive me crazy, right? So we tend, and Dr. Sparrow, I keep wanting to say Dr. Brazelton because I trained with him, but Dr. Sparrow said today, Ron Lawley calls it protective urges, and that's that we feel, those of us who work with children and families, we have that deep passion and love for that child. And we want to be sure that the child gets what they need. And if it's not happening the way that we think it should be happening, then sometimes we get very frustrated with the family. So it's important to keep that perspective in mind, that you, as well as the family, have those protective urges, right? And Dr. Sparrow also refers to them as gatekeepers, right? We're the gatekeepers that are either letting children in or keeping them out, if you will, instead of having that mutual caring work together. Okay, and I hear this all the time. Have you experienced that? Frustration that you've talked to the family and you've talked to the family and you've talked to the family and you've given them resources for referral and nothing has happened. Have any of you had that experience? Yeah. So I think this is where I wanted to change my slide. We're going to talk about the parents' reaction in a bit, but thinking about how they're going to receive the information. And what Dr. Sparrow said is that depending on how they get that information, it can cause post-traumatic stress disorder. And you heard him say there's more depression in families with children of special needs than there are comparatively in other families. So you don't know if you're the first person who's brought this up or the 10th, right? I remember a good friend of mine, a family that I worked with, she had twins. And when her twins were born, they hustled them right out of the room. They were a little early, so that's not so unusual. And a doctor came back and said, they're doing okay, your son has Down syndrome, and turned around and walked out. So that trauma, and I first met this family when the twins were 2 years old, and that trauma stayed with her for a long time because she didn't do any, it was a high-risk pregnancy, so she didn't do any of the prenatal testing. This was quite a while ago, so those kids are probably like 24 now. So they didn't have the spectrum of tests like they do now. So how they receive this information and what's going to happen is not predictable. We don't know, unless we built that relationship, and we'll talk about that a bit. Okay, so this is just to say, trust your gut, listen to yourself, Self-care is something we talk about. You know, what is this bringing up for you? Has it triggered something from your own childhood? Has it triggered a past experience that you had with a parent? I one time had a parent slap me and another parent spit on me, right? And I've learned since then that I could have improved the delivery, right? So it's a learning process for all of us, right? So talking it over with somebody, and typically I do a role play for this, and we might have time to do that because there's only a few of us. Talk it over with somebody, a colleague, a friend, if you have a social services person in your organization. I always tell people you could call me if you want, and I'll run through it with you. But think about what you want to say and how you can say it before you sit down with them. You can't plan for everything because you don't know what the reaction. Sometimes you have a pretty good idea because maybe you've had conversations with the parent previous to having this formal conference. So think about it. Okay, I'm going to give you a little quiz here, real quick. All three of them. You want one too, Monica? Sure. Go ahead.
If you know that a parent's going to be in denial before you even, because I have twins and I've had the twins' brother. So anytime we shared our concerns, there was denial. So one of the children we feel may have some developmental delays. If you know that they're going to be in denial even before we talk, what are some strategies that you would suggest?
Okay, we're going to get there.
Okay.
Okay, can you hold on to that? That's a very good question. And often what I hear from teachers, they're in denial. So we'll talk about a little bit about denial. So this is, you have on this little quiz thing some developmental milestones. And there's different choices in each area. So just write down what you think the appropriate age might be. And this is from your own perspective, not anything you've read in a book or whatever, your own experience if you have children. Or if you don't agree with any of those, you can list another age on the far right. And then on the bottom, there's a couple of questions, 3 questions for you. And I'm not grading this. I say this is my dream job because I get to teach without grading. I know, that grading's a lot of work. I'm getting old. And for those of you watching virtually, this quiz is online as well if you'd like to use it. And to my other CPIN leads, I don't know if you've done it this way, so now you can use mine if you'd like. Okay, got a general gist for each of those? Okay. I'm not going to go through them one by one, but I'll hit a few of the hot buttons because I used to teach infant toddler classes, and these were things we could talk about for an entire 3-hour class. When should babies be weaned from the bottle or the breast? What are your thoughts on that? 16 months, the first column says 16.8, 18.2, 36.2, which is over 3. Anybody want to venture what they put? 12 months. Okay, so you had another one coming up.
Yeah, my only 12 is yeah.
Yeah.
Wiener they did by 12 months.
Right. So there's an it depends, right? It depends on the family. Yeah.
I've seen, if I would do what you did, but where I work, it's so many different cultures. It's a big string. So I've seen 2 years, I've seen 3 years, I've seen 12 months. So it depends what.
So very perceptive. Did you want to share what you think? 18. About 18, okay. By the way, there's no right or wrong answer here. Let me see which other ones are really, it's not on here, but when should a child give up a pacifier? Go ahead, why are you hiding your face? Tell me.
I encourage my parents to start giving it to them like about 10 months or when they start talking.
Okay, to get rid of it,
Yes.
if they can, wean them off.
Wean them off of it just because when they start talking, the possibility.
Yeah, the kids can get very adept at talking around them.
That's actually the child that I was mentioning that
Right.
might be in denial.
Still has the Bessie. Okay, so important that we all have our own viewpoint on this. And you're very perceptive because this was a study done among various cultures and what parents thought was the appropriate age for those things. And what do you base, yours was a very practical decision, right? So if you could have, would you have waited longer? She was ready. Yeah, so sometimes it's readiness on the part of the child, right? Okay, so we have, fairly okay here, a few months here or there. But some of these, like the training cup, have any of you ever tried to drink out of a sippy cup? It's hard. It's hard. It's like a bottle.
I noticed my 12 months to 14, when I give them open cup, they're like, oh, this is better.
Yeah, right. And what's the point? If you're trying to train them to drink out of a cup, that ain't going to do it. Right? It's not going to work. So just, and again, culturally sometimes dependent. It depends on where you are in the world, So you can see there's pretty much variation in here. And that's exactly what you were touching on. What is the family's practice? I was talking with a teacher last week, actually it was Monday, this week, and she was saying, they have a child in their classroom and has some challenging behaviors, and she was saying, I know that mom spanks him. And, of course we don't do that in centers, but it was sort of the teacher's way, as I dug a little deeper, of saying he's waiting for a spanking. He keeps pushing because that's his signal to stop. And it's not our job to say to parents, you shouldn't be doing that, right? It's their culture, it's the way she was raised, and she's raising her child the way her mother raised her, right? And I love this saying, I heard it first from Oprah, but it's, who was her mentor, Oprah's mentor, the poet, Maya Angelou, said, when you know better, you do better, right? So parents we're not going to always agree on what should happen when. And that's really important to keep in mind. And that's where I loved what Dr. Sparrow was saying, those 8 questions. What do you call this? How do you manage this, right? Instead of what we usually do is, as teachers, as educators, we do most of the talking and less listening, right? And you've heard the saying, there's a reason why you have 2 ears and 1 mouth, right? So keep that in mind. So the bottom questions, I think these are even more interesting. Ask, should children and parents play together? And the European American mothers, which I would call whatever is mainstream, doesn't have much meaning in the Bay Area, but almost 100% of them thought you should play with your children. The Korean mothers, just over half, right? This study is 2000, so it might be different nowadays, but do you want the boys to play with trucks and the girls to play with dolls? Sex-type toys, we call them. Korean mothers said yes. More of them said yes. And about half here. And then providing children chances to decide, right? So not quite 2/3 of European American mothers or European mothers said, yes, you should give toddlers choice. We train them that way, right? And the Korean mothers said, are you crazy? Right, no, they didn't say that. I remember my great-grandmother. My great-grandmother was alive until I was in my 30s. A lot of young moms in our family. And I remember her watching me with my own daughter when she was about 2. And I said, would you like mac and cheese for lunch? or do you want peanut butter and jelly? And my daughter said something else, like I want a turkey sandwich or whatever. And my grandmother is looking at me saying, why are you asking her that? Right? So things change not only among cultures, but they change from generation to generation, right? Depending on your own upbringing and your knowledge. I always say, apologize to my children, saying I didn't come into child development until later in life, after they were in middle school and high school. So I do a lot of apologizing because now I know better, I do better. I'm a great grandma now. Not a great grandma, but a great grandma. Okay, so one of the tenets of the frameworks is that we partner with families, that we respect our families. I think that's the most important word there. And that we want to have them as partners, right? Did anybody attend the Boys of Color session here on this? Fascinating. However, what we know is the suspension rates among boys of color are almost twice that of other groups. We also know that preschool suspensions are 3 to 5 times greater than K-12 suspensions. I love when I say that because I just get these like, what? There's lots of good research out there. I can refer you to it if you want to email me. However, what we're looking at as challenging behavior might not be considered so within that family, right? There might be a different way to look at kids, right? So we want to know what is the parent's philosophy? What is happening? And how are we going to know that? Yeah, you have to ask. It's just like cultural. We talk about cultural competence. None of us will ever be culturally competent because we can't live that experience. But we can have culturally responsive teaching, right? And that includes, what is this family's belief system? So we want to be partners. I just attended, or actually I was reading it online, a research, and it said around children with challenging behaviors. And the author, who is Norman Kunk, who's very well known in special education settings, he said, I've never seen a child suspended when the parent and the teacher have a good relationship, right? So building that relationship is key, and that's what we're gonna move in. Okay, focus on the child. We're not focused on the parents, on what they might or might not say, but keep your focus on that little one, right? Start with strengths, always. Make a list if you have to. Have somebody else come in and observe, because sometimes you get so up to here with that particular child for a lot of reasons that you don't see, you're not objective anymore, and that's human. You're human. I remember one of our Head Start teachers, in fact, it was in this very room, and she was sitting right over there, and this was probably 18, maybe 20 years ago, and I've never forgotten this. She had a very challenging child in her classroom, and she said that they called in, and this is Head Start, so they have a lot of resources, so they called in the social services folks, and they came and observed him. And the social worker had written up a description in her observation. And she said, he is a very handsome child, which we don't usually say in an objective observation, but he's dark eyes, dark hair, he's a little bit above average height. And this teacher said, when she read this, she said to me, this still gives me chills, Linda, he gives me so much grief, I forgot what he looked like. And it was so telling to me that we just keep focusing on what's wrong and what's not okay instead of looking at this child. Another program that I went in and consulted with, they had a little boy who had been there since he was an infant, and he was now 5. And he was very aggressive. He was punching people, hitting people, punched a pregnant teacher in the stomach. And I had the whole group of teachers, and I said, tell me what his strengths are. That's what I got. Right? Now, I had observed this child like 4 different times already. And so I said, can you think of one? Can you think of one strength? And by the time we got finished, they had this amazing list of what this child's strengths were. He was a good leader. He was very intelligent, very quick to learn things. He would help other kids when they needed it, when he was not, upset or anxious. So, and remembering the importance of the child in the family, that they are the source of that parent's and that family's love. And we don't want to do anything to jeopardize that. Okay. Now we're going to focus a little bit on relationships. In real estate, the saying is location, location, location. In early childhood, we say it's relationships, relationships, relationships. So you were sharing earlier about a child maybe having trouble adjusting to a program. Well, you're new to them. All the other kids are new to them. It takes some time for them to build that trust and that relationship. So always at the foundation of any interactions that we have with children or families, we need to keep in mind that we have to have built a secure relationship. And that requires trust, right? And faith in who you are and what your intentions are for their child. Anybody familiar with the pyramid model of behavior? Center for Social Emotional Foundations for Early Learning. We call it CCEFL because we have an acronym for everything. But it's a pyramid model which shows how to, it's essentially a PBIS, does that ring a bell? Positive Behavior Intervention Support. It's a system for managing behaviors, and it's primarily preventative. And we use a pyramid model to illustrate it. I should put them up here. And then on the bottom, the foundation of that pyramid is relationships, okay? So until you have that, and then as it goes toward the top, there are fewer and fewer children because most kids will be at the next level, which is preventative measures to work with. We do offer that training here at the county office, and it'll be on the Inclusion Collaborative site, so if you're on their email list, I believe it's in the spring this year. Do you remember, Monica? Yeah, but it's offered all over the state. And it's through the West Ed Center. So we want to have ongoing conversations, informal conversations. Do any of you get to do home visiting? Yeah, okay. So in the home visits is a really nice environment. Our Head Start teachers do it twice a year. But if you have an opportunity to do a home visit, that's a lot more, or a lot less, I think, threatening than doing something at the school. So if you have that opportunity, that's a great opportunity to get to know the family better, see the circumstances that the child is in. Many of our kids are in, have 10, 12 people in their household. So it's a pretty chaotic kind of environment. So that makes it. Okay, so we want to be specific, all right? Here's what I hear teachers say. In fact, I heard one say it this morning. She's always running around the room, making noise, taking her shoes off, right? And this was school age. And I'm thinking, so what's wrong with taking your shoes off? About this time of day, I usually have mine off under my desk, right? So, but it's this one child is disturbing everybody else, right? And I tell my daughters who are mothers now, children push the hardest where they're loved the most, right? So they're gonna give you more grief as the mom than they probably will anybody else. But once you've built that relationship with children, and this is often when we do behavior intervention plans, you'll see the behavior escalate before it gets better. Because they're gonna push back and see, does she really mean it? Is that really gonna be the way it's gonna be? So have examples and documentation, notes that you've taken, observations. If you want me to come in and do an observation, since there's only 3 people here, I'm available. But if you get a second opinion is what I was saying, basically, and to look at and help you garner examples. So it would sound more like, not like he's always running around, she's always running around the room taking her shoes off, but when we are sitting and doing quiet work, she likes to get up and walk around the room and take her shoes off. And that seems to be that's disruptive to the rest of the kids. Okay, so we don't necessarily want to tie it to the rest of the kids because this is about their kid and they don't care about the rest of the kids like we do, right? So, yes, certainly, yes.
Number 2, is it okay to wait for parent-teacher conferences such as after DRDPs to address challenging behavior, or would there be a time we should have a formal meeting sooner?
Okay, the answer is, what I tell you, the answer is always in child development. It depends, right? Thank you for that question. If you waited until after the DRDP, you would have some hard evidence, right? You have your observations in there. However, if the behavior is such that it's maybe harmful to other kids, maybe harmful to teachers, then we may have to move sooner. You don't have to wait for a DRDP to have observations of what's going on, right? So I hope that answers the question. Tell them to come back. But again, it depends. And I always tell teachers, I told you this before, but follow your gut. Follow your gut, especially if you've been teaching for a long time. You see things that other people don't see sometimes. And the children are different in different settings. Do you act differently when you're at home than you do other places? You like yell and slam doors and, get mad at people. Get your shoes, get your backpack. Come on, we're ready to go, right? So kids do too. Often teachers will say to me, the parents say that he never does that at home. And my response is, why don't you believe them? Why don't you believe them? Because there's 20 kids in this room. He's the only one at home, right? So giving the parents the opportunity to understand that this is something that's happening in this environment, and it's not their fault. Parents don't have a remote control. Teachers will sometimes say, would you talk to him about this? Because he's not sitting. And then they'll tell me, oh, the mom talked to him, and he's doing better, right? What do you think that mom did? I was just recently, it was last March, Read Across America, the Dr. Seuss book, Cat in the Hat. You all know Cat in the Hat? So at one point in the Cat in the Hat, they've made this big, huge mess in the house, and mom is coming up. You can see mom through the window. And I said to the kid, doing my dialogical reading, I stopped and said to the kids, what do you think the mom's gonna say when she comes in? And one little girl goes, she's gonna get the belt, right? So we don't know what's gonna happen. I call it tattling. If we're tattling on the child to the parent, we don't know what the repercussions might be. Because teachers, some parents respect and fear teachers, depending on their own experience, right? So they may think, well, if my kid misbehaves, the teacher's not gonna like my kid. And that's gonna cause consequences for him. So do your homework, basically. So we want them to schedule some time that's uninterrupted. We don't want necessarily the child to be there unless it's an older child. And often they're part of a conference piece. Box over there. So comfortable, at ease, as much as possible. Oh, we're doing good. Privacy, you don't want it to be a place where other people can overhear what you're talking about, unless they're related to the conference. You need to give it enough time. Sometimes they're over very quickly. Sometimes it might go on for an hour. I usually say allow at least an hour. You may not need that all, but. And then if an interpreter is needed, arrange for that. And we don't like to use older children as interpreters, especially if they're part of the family, because it puts them in a difficult situation often to say something to their parents that may not be culturally appropriate in their particular family. Okay, so here's the listening part, right? See, she's got her, teachers are always going, but. Right, so asking the family how they see their child's development. What's that gonna tell you? It's gonna tell you what they know about child development maybe, right? What are their observations? Is this the first child in their family? Or is this the fourth or fifth? You know, as Dr. Sparrow said, don't we all wish we could have done over our first kid, right? It was Irma Bombeck, I don't know if anybody, the humorist Irma Bombeck used to say, it's like a cookie sheet that gets all burned. You wish you could throw it out and start again, get a new one, right? So listening will help us understand the parent's perspective of this child. When I worked in the toddler lab at San Jose State, and we would do parent conferences 3 times a year, and I would always end the conference by saying, what do you like best about your child? And some parents could do, and he's this, and he's joyful, and he's funny, and other parents couldn't say anything because they were struggling so with this particular child. Okay, the positive, always start with the positive, the strengths, right? The strength. And sometimes we have to reach, but we all have them, right? We all have strengths. I wouldn't use the word behaves in this context, but I would say ask what the child likes to do at home, what does he play, how does he interact with his siblings if there are any, those kinds of things. And if they've not indicated any concerns, ask them, do you have any concerns about your child? Because they may, oftentimes when you end up having this formal conference, they will say to you, you know, I thought something was wrong, right? I had a friend that I work with, and her daughter she was a preemie, and had severe cognitive and physical disabilities. And this was her first child, and she kept asking the pediatrician, you know, this doesn't look right, she's not doing this, she's not doing that. And he kept saying to her, oh, it's okay, she'll outgrow it, right? And I hear that a lot from parents. So they may have already approached a physician, and said, I'm worried about. And because development is so varied under the age of 8, really, but especially birth to 5, what is normal for one child may take, you know, if one child sits up at 5.5 months, another might not sit up to 7 to 9 months. And that's all within the typical range of development. So knowing that the parents, so finally this friend of mine, when she finally kept going and getting a diagnosis, and she finally said, I was so relieved when the teacher said that because she saw what I saw, right? So sometimes parents don't know how to express to us, so asking them, is there anything you're worried about? Anything you're struggling with? You know, we're here to help. Okay, so clearly, without judgment, with concrete examples. The middle one is the hardest, okay? Because we all have our own set of biases about how children should be raised. Okay, these are videos that are available free online from the Connect, they're Connect modules, and they're meant to use with adults. I use them when I teach the Child Family Community course, as well as children with challenging behaviors, as well as social emotional development. So it talks about developing relationships, really. And there's a beginning ground, a middle ground, and a later ground, right? So in the beginning ground, we probably wouldn't be doing an intervention, right? We wouldn't be having a formal conference. In the middle ground, we're knowing the family a little bit better. We know a little bit more about them. We've had a little bit more time with the child. And there's no timeline for this. And then the later, when we can really get down to those concerns and think about it. So this one is middle ground. I chose middle for you because I thought that would be easier to see. So they're already to the problem.
Kim, I want to thank you for coming in today. Now that we've had some time to be in session in school, and we've really gotten to know Ella a little bit better. And I'd like to hear more from you about what you think about the school experience and what you're hearing from her.
She seems to have been having a great time. She's very, very happy with her friends that she's made here.
Well, that certainly reflects what we see in the classroom. She's just 100% involved in her school day and very enthusiastic about everything. And I recall when you first talked with me about her, and you talked about her love for art, and that is certainly something we've seen at school. You know, when I also think about conversations that we've had before, I know that at one point you were talking, you know, certainly you have a new baby in your family, and we talked about Ella sort of going from being the baby herself and the youngest to being the middle child now. So she has this older sister, and she has this younger, and there she is. And so I want to hear a little bit more about what's going on at home. We've seen a little bit more tenderness on her part.
Okay.
So I'd like to hear a little bit more from you, if that might be what you're seeing at home as well.
Yeah. When I think about it, there's some moments, I guess, when might break down more than usual, or not be able to get herself back together, I guess.
It would be very helpful for us. Could you tell me a little bit more about what you do at home when this happens, when these type of situations come up for you?
Yeah, so oftentimes it seems like it's in the middle of a transition maybe, and she just falls apart completely, and I'm not sure where to go. But if I try to talk to her, and sometimes I want to hug her like I do with my older child, she doesn't seem to take to it very well. So I just give her space. I let her sit and sometimes scream or talk and just get over the subject and tell her that I'm there, she needs me, and she just does what she needs to do in an area by herself, and then she comes up when she's ready and we move on. It usually seems to work.
Oh, okay.
Yeah.
Well, that's very helpful. You know, it makes me think right away about a few spaces that we have in the school that are these quiet areas. So I'm hearing what you have to say. It's making me think that this might be a good area for her to go to when these times come along for her at school.
Okay, what'd you think? Who did the most talking? That one's pretty equal. Yeah. So that's kind of how you would want it to be, like a conversation, not like tattling on the child. Right? Yes. So it was obviously they have a good comfort level with each other. Teacher started out with what? Yeah, she loves to be here, she's enthusiastic, we enjoy her. You know, when a parent hears that, they're gonna, the shoulders they're gonna relax a little bit, because you see something wonderful in their child, and they know that you have noticed that. So I like the way that they handle that. I have others, you might wanna go in and look at some of the other ones, like the beginning, some of the beginning conversations, because often teachers are doing the most talking. And what I hear when we do the role plays, I just heard this one, that the teacher was sharing information with the parents about the child not being able to attend in the circle time, that almighty circle time that we all have to have, and kids need to sit there and be quiet and listen, right? And she's sharing this with the parents, and the parents said, well, she hardly ever sits down, she really likes to move. And the teacher's response was, well, but don't you want her to be successful in kindergarten? Well, how are you going to answer that? No, I don't care. She can do whatever she wants, right? So whenever we say but to a parent, we are negating whatever they said, right? It's a way to disagree. And there doesn't need to be a disagreement about this. We want to be partners in this process. So I want to get back to your question before we run out of time about parents being in denial. Okay, I don't know if you've done any reading or have heard of the work of Elizabeth Kubler-Ross, who talks about death and dying and the grief process. You may have heard the grief process. So it goes, I don't think I have it on a slide here. No, I don't. Okay, so it goes, the first stage of grief is denial, right? And then you move on to anger sometimes. And that's when I told you about the parents that reacted to me with anger. And sometimes the anger will be aimed at you as the teacher. And then there's depression and acceptance, and they kind of, most people get there eventually. But there's no timeline on this. There's no, you're not in depression for 6 weeks and angry for 6 weeks. My father died when he was 46, very suddenly. And my mother, I think, stayed in that anger stage for at least 20 years. At least 20 years. She just couldn't get past that abandonment, if you will, even though it wasn't his fault. So this is what I say when the parents, denial is where most parents are going to be if they've heard this for the first time. No, there's nothing wrong with my kid. We just offered services to a family, and where we start is mental health services, often with the family, and the mom said, there's nothing wrong with his mind or my mind, right? So when they think mental health, there's a stigma that's attached to that, right? So if that's where they are, that's where they need to be. Does that make sense? Yeah. And sometimes you don't know how long it's going to take. It may not happen because we only get kids 1 or 2 years. Some programs maybe 3 or 4 if you have infant, toddler, and preschool. And we don't know when that's going to hit. The mom that spit on me came back to me 2 years later and said, Linda, you tried to tell me this, and I didn't want to hear it. I didn't want to see it. And then she felt very guilty. And I said, you can't blame yourself. It's not your fault. For those of us who heard Dr. Sparrow, one of the first things the parents think when they have a child with a disability is, what did I do? Did I do something wrong? Did I eat something wrong? Did I drink something wrong? Often that's what happens. So let them be there. And then what's the next stage? Anger. Yeah. So they may, and not everybody goes through every stage, right? But they may be there for a while. And I would say, it doesn't always happen, but in my experience, more often than not, parents will be angry. They'll be angry, why didn't my doctor say something? Why didn't my mother, who's a teacher, say something? I get all my kids, have kids now, and all their friends call me, Linda, what do I do about this? What do I do about that? I always say it depends, right? Because they're all different. They're comparing their kids to other kids because we're a very competitive society. So just helping sit with them in that moment and let them process. So often if this is the first time anything's come up, and we don't diagnose, do you diagnose? No, you're not a therapist. So who diagnoses if there's a special need? Who can diagnose a special need? Say it loud. She says a psychologist, psychiatrist, medical doctor. Okay, so they use the DSM-3, 3 or is it 5 now? Maybe 5 now. But that's a diagnosis and statistical manual that they can look it up and say, there's a kind of a checklist. Does the child do this, or not do this, this? And then they use that to support their diagnosis. So we don't diagnose. Even if my graduate work is in special ed, and I usually have some idea of what I think might be going on, but I'm not qualified to diagnose. And I'm certainly not going to share that with a parent that, well, I think your kid's hyper. Because what do we attach hyper to? What disability? ADHD, right? We can't diagnose this. Little kids are hyper. Trust me. They run around a lot. And that's what a moving child is a learning child. They say there's a book called that. Okay, so if the parents are ready to hear this, which most likely they will not be the first time you talk to them about it, give them time. Say, if they disagree, say, I can see that we disagree about this, so why don't you take some time, think about it, and then come back and we'll talk again, right? So give them the gift of time. You may be, really struggling with this child, but maybe they're not at home, right? I tell teachers, unless you're a fly on the wall, you don't know what's happening at home. Teachers will tell me all the time, this child has no limits, he has no rules, he can do whatever he wants to do. He climbs on the furniture here because he can climb on the furniture at home. I say, how do you know that? Do the parents tell you? I've never met a parent, tell me if you have, that says there are no rules in our house, there are no limits, they can throw food if they want to, they don't have to, they can eat whenever they want to eat, they can go to bed whenever they want to go to bed. I've never met that parent, not yet. Now, might things be different? Might kids be allowed to climb on the furniture at home? Well, it's kind of hard to stop them if they're little. How else are they going to get on the couch? So some things that are typical are things that we might have to monitor or limit in the classroom because of safety issues. Okay, so believe them if they say that. That's the thing. So have resources ready if needed. If it's challenging behavior, that's not a diagnosis, by the way. So those are things that we need to keep working with the family and the child and keep trying. Now, sometimes challenging behaviors are related to a diagnosis. We know that kids who have a lot of chronic ear infections when they're very young may have trouble hearing. And if a child, if you hear the teacher say he doesn't listen, or you hear the parent say he doesn't listen, the first thing to do is test the hearing, right? Test the hearing, because maybe they're not hearing what you're saying. You know, Dr. Dean Adele, who used to be on the radio, used to say, when you hear hoofbeats, think horses, not zebras. Okay, so think of the most common thing, the most easily remedied thing first, and that's, does the child get enough sleep? Does he have enough to eat? Is he tired? Is he hungry? Is he not here? Is his hearing impaired? Is his vision impaired? You'd be amazed. First Five in Santa Clara County sponsors vision and hearing screening for kids, and they pick up many kids, I don't know the exact numbers, every year in preschool that have vision or hearing problems. And that's easy to correct, right? But think how important if the vision went undiagnosed. I see you got glasses, you got glasses, you do this to me. I have a disability right now. I can't drive my car. Monica have to lead me back up to my office, right? Okay, so have those resources available. Does everybody know what the resources are in your community? Yes, no, maybe so? Okay, I'm gonna give you a list. Okay, so this is just being patient, waiting, and letting them decide when they're ready for an assessment or an evaluation, if that's what you're recommending. They may be interested right away, that's great. They may not be, okay? So they're not ready, that's okay. Be ready for anything, because you'll get a variety of responses. If they want access to services, if they're ready, be sure you have those available. For children birth to 3, it's early start. And for children over 3, it's the school district that will assess the child. Actually, it's 2 years, 9 months, because they need to get it done ahead of time. Here's what, this is often a question I get. I don't know if it's come in yet. How do I know when I should refer? Right? Have anybody referred a child for special ed or testing? How did you know that you needed to do that? I need you to, I gotta get closer because I can't hear you. Yeah, she doesn't like the mic. That's okay. I'm slightly hard of hearing, so that's my disability.
Based on the initial evaluations, the ASQ's observations coming from the parents.
Okay.
Good, because not yet further pushing them, but yeah, it's basically in the initial evaluation.
Okay, so the initial evaluation, was that a screening, like an ASQ or something? Yeah, so ASQ is, here's what happens at the end of the 3-day conference. It's a screening tool. I'll think of what it stands for in a minute. Questionnaire. Say it. Ages and stages questionnaire, thank you. And there's also an ages and stages social emotional questionnaire. So some programs use that, and that may, so this family had some red flags, and they were ready to find out more. So that's super. That's the best outcome you could hope from. So this is just saying what we were already saying. If they're in denial, let them sit there. Let them stay there until they're ready to move on. Unless, and this is the when to get outside help piece that we do, it's a medical urgency. You're seeing the child maybe has asthma and is wheezing and having difficulty participating in the program, or really can't go outside at all when the pollens are up and the risk. So if it's a medical emergency or urgency, then you need to move forward. And teachers can refer with parent permission. So I'm worried about this, Mom. Would you mind if I had the child's, if I referred the child for an assessment, or in this case, a doctor's appointment, right? Okay. I'm going to tell you one thing before we finish, because I don't want to forget it. One of the things that I do, or did when I was in the classroom still, is write up my observations of the child by developmental domain. Okay, so you can do 4 big things: cognitive, social, emotional, physical. That's usually enough. And write up those descriptions, just a paragraph or 2, because you're doing observations on this child anyway, right? Say yes, Linda. We are. Okay. So use those and give them to the parent, and let the parent share it with whoever you're referring to. So I'm going to tell you why I did this once, and then I've done it ever since then, is because I gave one parent, this was the parent who was very much in denial, waited 2 years before she acknowledged, and her child ended up being diagnosed on the autism spectrum, right? So I wrote this up for her. Within 15 minutes, the doctor called me. And she said, I've never seen anything like this from a teacher before. This is so helpful. Thank you so much for doing that. So the physicians or the therapists don't see children the way we see them. They're not seeing them in the environment. So your viewpoint, your knowledge is critical to that family sometimes. So just something, it doesn't have to be a book. Okay, I think that's my computer freezing. I wanted to do one more thing with you. Why don't I stop here, because it's 5 till, right? Ooh, that one says 4 o'clock. Okay, I gotta get you out of here. We have 4:15 or 4? Okay, so we will have time. So would you do me a favor? Oh, maybe if I just do this, it'll work. I'm gonna try to escape. I'm gonna give you, you might wanna work together on this. It's frozen, it won't go forward. So maybe if I do escape and it'll work. An envelope of do's and don'ts for a conference. Not that one. There we go. And see if you can put them together in a list of do's and don'ts. What do you think is a do in there, and what do you think is a don't? And if you all 3 want to do it together, that's fine too. So for those of you virtually, this is also posted for you on the website, so you can get the list of do's and don'ts. The answers are posted for you. Let's see if that'll do it. Sometimes it does. Yeah, it did it. Okay. Okay, here's where we are. Any more questions come in? Okay, if anybody out there has any questions, this would be a good time. When I envision you in the virtual audience, I see you in the cloud. That's how I see it. You want to do them on the floor? Oh, that's a good idea. Stand up for a while. Yeah, sure. I know, you're tired of sitting. One of my professors used to say the mind can only absorb what the rear end can endure. Okay, sure. We have a question. Go ahead.
How do we keep a child from being suspended or sent home when they are being unsafe with students and teachers, hitting, biting, spitting, throwing blocks, escaping, etc.?
Okay, so how do you prevent that behavior? Yes. So you need to have a plan in place, and you need to be working on what happens, what are we going to do if he hits or kicks or spits or bites or tantrums, whatever, and be using that plan consistently for at minimum 6 weeks, maybe up to 8 to 10 to 12 weeks. So you're going to try to use all the tools in your toolbox. And if you need help, there are lots of resources which are at the end of the slides that you can go on the websites and look for information about how to support that child. Suspension is not an option as far as our Head Start programs are concerned and our state preschool programs are concerned. And the reason, my best analogy around suspension is if you send a child home for a negative behavior, how are they going to learn it, right? If they're not in the environment and in the context, it's kind of like saying you have a 5-year-old and you give them a brand new bicycle, two-wheeler, for their 5th birthday, and they say, as soon as you learn how to ride this, you can have it, right? So how do you learn how to ride a bike? You got to fall off a few times, right? So this child is going to fall off a few times. It may work for a while, and then you may need to reevaluate. But when we send children home, and we know that those rates are very, very high in preschools, and especially boys of color, Mexican American or Latin American and African American kids. So the last thing you probably want to do is say, you don't belong here, you're not part of this, you have to go home because you don't know how to do what we do in this environment. When we look at the Center for Social Emotional Foundations for Early Learning Strategies, or the California Pyramid in California, we're looking at what does the child need? What does he need to be taught? So we say, if a child doesn't know how to read, we teach. If a child doesn't know how to ride a bicycle, we teach. Child doesn't know how to drive, we teach. If a child doesn't know how to behave, we should be saying we teach, not punish. And suspension is a punishment, right? And very inappropriate for younger children. Hope that helps. If you have questions about that, let me know. How are we doing over here? So they're sorting in the do's and don'ts pile. This one doesn't get graded either. Do you have all 3 sets?
Yeah, well, they're the same.
Yeah, they're the same, so you just need one. That'll really mess you up. We'll be here till 7 o'clock. Yeah, they're the same. So she's saying leave it up to the parents to fix the problem. They're deciding if that's a do or a don't. Yeah, good word cues. Minimize is not what we want to do. Okay, so they got them. I'm going to put it up here. And if you downloaded it out there and did it, see how you did. Okay, so the very first one under do's, people disagree with sometimes. So you want to do this, but maybe not the very first thing in the conference, right? You don't want to start out by saying, I have a concern about your child, right? You want to have that initial conversation and then lead in it. So, but you do, what the point of this one is you want the family to know that you care and you're there to help, right? And then what you're worried about. Okay, we don't want to begin the discussion by indicating that the child's behavior is not tolerable. Okay, teachers say this to me all the time. I can't have him in here because he's hurting me, he's hurting other kids, and it's not safe. Here's something that I learned a long time ago, and I think Linda Brault says it in her book. All behavior is communication. All behavior is communication. So what is this child trying to tell me is what we want to try to figure out, Okay? So let the parent know your goal is to help. You're there to support them in whatever way that will work best for them and the family. Indicate that the child must be punished or dealt with by the family. My group here, by the way, did very well. No, it's not their job. You know, what happens in Vegas stays in Vegas. What happens in your classroom is your responsibility, right? I have this handout if you want to. I posted it as well. Ask the parent if she has experienced similar situation. The answer might be no. He never does that at home. Versus asking the parent if something happened at home. You know, that's really intrusive, right? It may be that comes out in the conversation. A stressor is a new baby. A stressor is a birthday party, right? So you want to see what the parent's view is, but you don't want to say, well, did something happen at home because his behavior has really changed, right? Or he's really acting out. I've heard people do this. Okay, tell the parent you want to work with them. You're going to help that child. You're going to be supporting the child to learn the appropriate behavior or whatever you're concerned about. If it's a disability that you're concerned about, you're going to get them to the right resources, and you're going to work with the professionals to try to implement whatever you can in the classroom. Initiate the conversation by listing the child's challenging behaviors or whatever they are. They should be framed as the child is having a difficult time, right? This is why it's a good idea to rehearse this before you do it, because you'll catch yourself if you're going to that kind of a thing. And challenging behavior for me might be very different than it is for you, right? I happen to like these kids because I think they make me a better teacher. They make me think. They make me do research. I remember we had a child with a rare disorder in one of our Head Start classrooms, and he had Marfan syndrome. I didn't know what it was. We all looked it up together and researched about it and worked with the family to help him. So you don't want to start with the bad stuff, right? Offer to work with the parent. We're a team. Even saying that, you know, I consider parents as part of my team, my teaching team, to help me. Emphasize that the focus is to help the child develop the skills that they need. And that would apply to learning their ABCs, maybe learning their numbers, and also learning social emotional skills, because they need to be taught. Children are not born civilized. That's our job, right? Don't leave it up to the parent to fix it. They can't fix what's happening at school. Emphasize the focus is to help skills, right? I read that. And stress working together, you're more likely to be successful. So, and some parents will be very receptive to ideas like visual schedules at home. We know that helps a lot of kids, not just kids with special needs. Okay, don't question or challenge their methods of discipline. That's not your job, right? Even though you may disagree, they're gonna be in that family the rest of their life. Right? So they've got to learn to function within that family well. And don't minimize that or misunderstand about implementing positive behavior support. It's interesting that this focuses on behaviors, right? Children with diagnosed disabilities, we often have a lot of information about, right? If they have an IEP or they have an IFSP, an individual family service plan, then we have information on that child's history, if they've been in other programs, maybe birth trauma, we know that, but other children come to us and we don't know anything, you know, or very little about them. So it's really in building that relationships. This is hard to do, and recognize that and acknowledge that and take care of yourself, right? Prepare, I can't say that enough. Prepare, 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 be ready. But you may be the tipping point. You may be, when we talk about resilience, I don't know if anybody wants any of the resilience, you may be that one connection for that child and that family that helps them develop and access those services that they need, right? So you may be the only person, and be courageous about that information that you have. Because if you didn't say it because it was going to be, I've worked with teachers who had directors who told them don't say anything to the family. No. Do say, if you see something, say something, right? That's the TSA announcement, but it's the same thing. Okay, so the rest of these slides are a lot of resources for you that have a lot of great information on working with kids with disabilities and or challenging behaviors. The CalSAC for school age, if you're working for school age. There's CCEFL, which I've mentioned several times, is a wonderful program that has a lot of online resources that you can access for your classroom or the groups of kids that you're working with. They have a list of books for social emotional development. They have actual lesson plans for those books. TAXI, we call it TAXI. Of course, it has to have an acronym because we're in education. And that is the Technical Assistance Center on Social Emotional Intervention. So there's lots of tools on there. The health and service providers, you want to start with the family's physician. You sometimes won't get anywhere. That's been my experience. And not to knock physicians, but how long do you spend with a pediatrician on a well child visit?
7 minutes?
Yeah, 7 to 10, maybe. So they don't, that's why I say send the letter with the family and let them use it however they want to use it, your observations, because the pediatrician won't see what you see, right? They won't have that time to do that. I remember my oldest daughter, my firstborn, my pediatrician, who I loved, and they ended up going to all through college because he would let them come back, and they didn't want to go to another doctor. He got up and started leaving the room, and I grabbed his coat, his white coat, and pulled him back. And I said, wait a minute, I still have questions, right? So he sat back down and said, okay, what are your questions? And then ever after that, when I had the kids in there, he'd say, Linda, can I go now? Right? But, sometimes parents have to push it a little bit or make a separate appointment with the doctor just to talk about this particular thing. Okay, we have lots of services. There's the family resource centers. The school district sometimes is challenging to work with, but be persistent. And the R&Rs will have information. This is another California Inclusion website, which is the people who developed this PowerPoint. And those handouts are on the site, okay? So I think we did it. I don't know who that is, but that picture was in there. I love it. Any final thoughts, questions? Was this helpful? I hope. Okay, good. So my email is on the slides. If you want to find me, if I can help or support you in any way, I'm happy to do that. We do trainings once a month for preschool teachers here at the county office, roughly once a month, and that schedule is on our website. So if we're Region 5. If you just go to the CPIN.us is our website, you can click on your region and that will show you where there are trainings available. Yes? Oh, one more question. You guys
How do you feel about showing parents video of their child exhibiting challenging behaviors? Is this appropriate?
Could be. However, I would be concerned about the context. First of all, be sure that you have permission to videotape from the parent. You can't do that without permission. It can't be used for anything but instruction, right? They ask how I feel. I'll tell you how I feel. I don't think it's the best way to start a conversation because in my experience, what happens is the parent punishes the child after they leave, right? So if you're deep into the relationship and you have trust and you're working together, then maybe that's a time where you could share. But before I would do that, I would invite parents to come in and observe. I've worked in a lot of lab schools, so you have an observation room. But if there's a place that they can observe without the child knowing that they're there, because they will act differently if they know the parents in the room, that would be, I think, better than actually showing the parent a video. Because what I'm hearing in that question is, you say he doesn't do that at home. Well, I'm going to prove it to you. Here it is, in living color, right? So there can be, I use video mostly for teachers because they don't often see what they're doing. And we're not objective about ourselves. We're not. I never do that. Yes, you do. Here it is, right here on my phone. So again, the answer is always it depends. The level of the relationship, how much trust you have between you, the parent wants or asks, but you should be able to give those examples verbally as well. For example, when we ask him to clean up, he tends to he likes to throw the blocks into the shelf instead of placing them. So here, and you would follow that by saying, and here's what we're doing. We're working with him to demonstrate the way that we do things. Here's another thing I hear, just to wrap up. Teachers say, I can't be spending all my time with this one kid because I have 20 other kids in this classroom, right? TK teachers we work with, they have sometimes 30, 32 kids. There's a difference between fair and equal, right? I don't think I have that slide on this one. But it's the you've probably seen the slide somewhere where they have the little kids looking over the fence to watch the baseball game. They have 3 people, and they're all different heights. And it shows each one on a step stool, and the little one's still too low to see. So then it's changed around where the little one gets the steps he needs, and they can all see over. So, and the illustration that I use is if I have a child who comes in hungry, and I have 1 graham cracker, what's equal is giving half to this child and half to that child. What's fair is giving it to the child who didn't have breakfast, right? So sometimes, and again, the squeaky wheel gets the oil, right? We want to be sure we're not giving undue attention to negative behaviors, but that child needs you the most. And you're the person who can be in that position to change his whole world. We know this from the research. One teacher. Can you think of one teacher who made a difference in your life? Hopefully we all have one. And one teacher you really didn't like. Hopefully that's not me. Okay. So with that, have a great weekend. Thank you for sticking it out. I really appreciate somebody to talk to in the room. You were great. So, and don't hesitate to contact me if you want a training for your site or whatever. We'll do what we can. Thank you.